Well, let me ask you this then, because you mentioned both nutritional protocols and also in areas like stress, that you need to be aware of what you can do to help yourself reduce stress or to protect yourself against it.
Right.
So tell me a little bit about what you consider a nutritional protocol and give me an idea of something that I might want to do if I'm under a lot of stress and I'm not really having to medicate for it, but I need to do something to help bring it down.
Well, I think there's a couple things that people should really look at for dietary supplements as, I'd say, a blanket approach. In my eyes, everybody needs a good multivitamin and mineral. I think I mean, unless you're under a rock, the data is fairly clear that people need to take a good multivitamin and mineral, because even when they try to eat good, healthy food, the mineral content, the nutrient content in the food is variable. And so ensure yourself. And there's been great studies that show that a simple multivitamin can have all sorts of positive benefits to wide different populations that have been studied. The other one is, essential fatty acids like fish oil. I think are important. People aren't getting them in their diet. Fish oils are vastly important for managing inflammatory chemistry in the body, and they're an essential nutrient. Now, when you go past that, there's some favorite nutrients that I really like. One of the biggest issues that's killing us still as Americans is heart disease. It still is just number one at taking out Americans every year. And for all the medication and all the surgery and all the medical effort that's been put at heart disease, we still have enormous numbers of people dying of heart disease every year. Some of it's lifestyle, some of it's environmental, some of it's genetic. But there's things that you can do that can kind of, I think, toss a blanket over all those diverse factors that trigger the progression towards heart disease. And I've been a big fan of aged garlic extract for, oh my gosh, probably the last decade, because there's 650 studies that validate that aged garlic extract does a wide variety of things in terms of heart disease prevention. Now, it's not just the heart disease prevention with it that I actually get excited about on getting people to take it. So the big things that it does is it makes your blood less sticky. So it lowers fibrinogen. That's fantastic. It reduces oxidized LDL, meaning that we're all up in the air about, oh, your LDL cholesterol, LDL cholesterol. It's not about LDL cholesterol. It's about if it's oxidizing or not. It's the rate of rusting that's going on in your body. And so when that LDL cholesterol rusts, that's when you initiate plaque formation. And so what I like about aged garlic is that it acts as a very powerful antioxidant that inhibits LDL oxidation. Other things that it does, it also helps with detoxification processes in your body. We live in a modern world. Lead, for example, has been highly correlated to the development of cardiovascular disease. I mean, in big epidemiologic studies that have been published in peer-reviewed journals, they're saying heavy metals like lead affects your heart disease outcome. So having a good, healthy cellular mechanism to be able to detoxify from lead is an essential part of us living in a modern world. And whether it's lead or mercury or pesticides, all these things we're reading are affecting our health. We need the defense. Aged garlic's interesting because it has a little compound in it called S-allylcysteine. And why I think it's so important is that upregulates a little chemical in your body called glutathione. And glutathione is essential to your cell's ability to detoxify. So that's just a few of the things that aged garlic does. I mean, there's a myriad of metabolic effects that it has, but it's known as kyolic. I use it in my practice and have for years, and virtually I have almost everyone in my practice takes kyolic. And for really the reasons I just described: detoxification abilities, it reduces inflammatory signaling, it retards LDL oxidation. In fact, they even did a study. Now, this is what's interesting, Lyle. When you are given a statin drug, you think that you're protected. If you've had previous heart condition or you've got plaque in your arteries, everybody goes, oh, wow, cool, I'm on my statin drug, and that means that I'm going to be protected against heart disease. Your arteries still continue to plaque.
No, really?
Yeah, really. And so the interesting thing is when they did a study where they gave statin medications or statin medications plus aged garlic, there's about a fourfold improvement in plaque laying down. So there was a reduction by about 70% of plaque over the next year when you took aged garlic with drug therapy versus drug therapy alone. That's where I think the new medicine is going to go. Let's take the value of these nutrients that have been highly studied and let's supercharge the medication that we have so you don't have to take as much medication, because we know medications have side effects. And so this is, I think, has tremendous value, and I think where the future of healthcare will be is how do we blend the good science that's in dietary supplements and natural products with what we know about good medicine, but desiring to reach out and reduce the side effects and the complications and the need for polypharmacy.
That's intriguing. I learned about aged garlic shortly after I came into this business from a fellow by the name of Charlie Fox, who has been one of my idols for the last 16 years.
He's the man.
I believe very strongly in it.